Uganda is temporarily closing the border with the Democratic Republic of Congo with immediate effect.
Uganda has closed the border with the Democratic Republic of Congo to halt the spread of Ebola virus. 7 cases have so far been reported. The Permanent Secretary at the Ministry of Health, Dr. Diana Atwini, said that as of May 27th, no new Ebola cases had been registered, though the number of contacts linked to the previous cases increased.
Most of these contacts are health workers because they were getting it from the one source. The total number of cases as per now is still at 7. And our initial index case that had died.
So, government has announced a temporary closure of the border with the DRC with immediate effect. The resolution follows a meeting of the National Task Force chaired by the Vice President designate Jessica Alupo.
The only exceptions are for authorized Ebola response teams, the humanitarian operations, food and cargo transportation, and security, but all this still will be under strict health screening and monitoring protocols across the border.
The Immigration Department has been directed to restrict all movement across the border except for personnel under the Rapid Response Cluster.
Immigration Authority is directed to permit only authorized Ebola response teams, humanitarian operations, food cargo transportation, and the security, even when it comes to air transport.
Even those permitted to cross will be required to observe self-isolation for at least 3 weeks.
But we shall do strict supervision of that isolation, and this applies in Kampala and also in all districts, especially the border districts where a lot of movements have been taking place.
Education institutions along the border will remain open, but government has advised learners commuting from DRC to stay away.
The day scholars who are coming from DRC, once we close the border, those students will not be able to come apparently because they are not exceptions. Only the exceptions are on humanitarian, health workers, security, and cargo. So if there are students coming through every day, unfortunately, the closure of the border will affect them definitely. School authorities are directed to identify all students that have come from DRC and have come in the school, especially for boarding schools. And these students must be monitored in terms of temperature taking daily for 21 days.
Ministry of Health has called upon security teams led by the RDCs to enforce compliance at community levels. Media houses have also been asked to dedicate at least 30 minutes daily to public sensitization.
If you work at a radio station, if you work at a TV station, if you are a radio presenter, you have a duty of care to make sure that you communicate to your audience the fact that they need to be careful.
By May 27, 2027, Uganda had recorded 7 Ebola cases. The public is urged to observe standard operation procedures, report any suspected cases immediately, and adhere to preventive guidelines issued by the Ministry of Health. Dorcas Kimono, UBC News.